Hi everyone! You just got your Tele-PrEP at-home STI testing kit from Novus Medical Services. Depending on your needs, you'll have anywhere from 1 to 3 swabs and tubes in your kit, which will vary in color depending on your insurance background. You should also see a lab script, which we'll review at the end of this video. Before you start your swabs, you'll want to get organized. The first thing you need to do is verify that each tube has your name and date of birth. Your next step will be to write the date of collection on each tube with a pen or marker. Please make sure that your name and date of birth are easy to read. Now, you'll want to match the correct swab to the corresponding tube. All of your tubes should be labeled, and make sure that you're placing the correct swab in the correct tube. Now, I'm going to demonstrate our throat swab, which will test for chlamydia and gonorrhea. See this little line? That's where it's going to break off after you swab your throat. You're going to open your mouth wide and firmly rub the Q-tip end across the back of your throat, starting at one side, going across the top, and ending at the other side of your throat. Once you've completed your throat swab, you'll need to use your other hand to unscrew the cap of the tube. Be careful not to spill the tube's contents. Place the swab into the tube so that the score line is at the top of the tube. Then, break the swab off at the score line. Then, tightly screw the cap onto the tube and then place it into your biohazard bag. Now we're going to be moving on to our rectal swab, which, believe it or not, is very similar to the throat swab. You'll want to lean over and slightly spread your legs. Insert your swab no more than 1 inch into your rectum, making sure not to go any deeper than that. You'll need to rotate the swab for about 7 seconds. After 7 seconds, you can take it out and locate your corresponding tube. Just like we did before, you'll need to place the swab into the tube so that the score line is at the top of the tube. Break the swab off at the score line and tightly screw the cap onto the tube and place it into your biohazard bag. For those of you who are doing a vaginal swab, it is also very similar. You'll need to use one hand to hold the swab and the other to separate the folds of the vaginal opening. Insert the swab about 2 inches into the vaginal opening while gently rubbing the swab against the vaginal wall for about 20 seconds. Again, you'll need to place the swab into the tube so that the score line is at the top of the tube. Break the swab off at the score line, tightly screw the cap onto the tube, and place it into your biohazard bag. Also included in your kit is a prescription for additional testing of blood and urine, which must be collected at your local lab. Your urine will be tested for gonorrhea and chlamydia, and your blood sample will be tested for HIV and syphilis. All PrEP patients must be tested for HIV every 3 months. If you have a question about your kit, how to administer your swabs, or how to locate your local lab, please feel free to contact our patient care coordinator at 610-419-0623. Once you receive your test results, our coordinator will reach out to you to set up your next appointment. Bye!